Hello everyone, this is Dr. Shishma Sarela, consulting homeopath at Fidicus Homeopathy. Now we'll get to know what is the effect of hypothyroidism in PCOS, or how hypothyroidism causes irregular menstruation and how it causes infertility, how it causes anovulatory cycles, and how it causes a cyst in the ovaries, and how it can maintain PCOS as well. Through this flowchart, I'll be explaining it to you in a much clearer manner how hypothyroidism can cause or can trigger PCOS. So let's get into it. As you know, hypothalamus is the main thing that releases GnRH. If you have seen our previous videos, you would understand that PCOS is also related to GnRH pulsations or the release of GnRH, right? But in PCOS, we have too much or excessive release of GnRH, whereas in hypothyroidism, we have very low pulsations or low amount release of GnRH. Why? It is because of too much secretion of TSH. Remember, hypothyroidism is low level of T3 and T4 and too much production of TSH, right? So whenever there is too much production of TSH, there will be hyperprolactinemia, which is increase in prolactin levels in the body, which will cause the GnRH to reduce, okay? And when the GnRH is reducing, what happens? The pituitary is not properly triggered and it does not release the proper amount of luteinizing hormone and follicular stimulating hormone, which is very important for what? Follicular stimulating hormone is very important for maturation of the Graafian follicle, that is a release of the egg, as we can say. Okay, so the egg should be released, right? So there is no release of the egg without follicular stimulating hormone being in a proper level. So there is decrease in FSH and LH. So what happens to the ovarian follicles? There is formation of fluid, or whenever a follicle is trying to mature, whenever there is no proper FSH to the follicle, what happens is that there is formation of fluid, excess fluid in the antral follicles. So they develop into cysts, okay? So follicles do not grow, they do not mature properly, they do not grow properly, and then the antral follicles or the follicles as such can develop into cysts. And whenever developing into cysts and there is no release of ovum, that is called nothing but anovulatory cycles, which are also present in PCOS, right? And then what it does is, see here, there is no ovum at all, so there is no chances of pregnancy, right? So there is infertility. And by chance, if you are having ovulatory cycle, what happens is that the uterus endometrium is also, like, it's very liable to the progesterone and to the estrogen level, right? So what happens whenever there is no formation of Graafian follicle, or whenever there is no release of the egg, what happens? There is no formation of corpus luteum. Okay, so the corpus luteum is something which is responsible for the production of progesterone. Fine. So the progesterone level is very low. Whenever there is low progesterone, what happens? The endometrial thickness is not proper. Okay, remember that every time for every menstrual phase, our body prepares so that we will have a baby. That is, endometrial thickness will start to grow. Whenever there is low progesterone, what happens? Endometrial thickness will be very thin. So even if you are conceiving in the fallopian tube, that is, fertilization takes place in the ampulla of the fallopian tube, right? So whenever there is fertilization in the fallopian tube, it moves to the uterus for implantation. What is implantation? It sticks to the uterine wall and the baby grows there. Whenever there is thick or proper endometrium, the baby will grow properly. But whenever there is thin endometrium, it can rip off, leading to miscarriage, or as we call abortions also. Okay, so that is also the reason why people experience miscarriages when they have thyroid issues, in cases where they are not using proper medication or the dosage is not set right to their body. Okay, it's very important. If you're someone who is watching this video, if you're pregnant, do get the profile, whatever profile your gynecologist is suggesting you, do get all of the serum profiles done very regularly. And also watch over your consumption of goitrogenic foods. What are goitrogenic foods? That is cauliflower, cabbage, papaya, even ragi comes under goitrogenic agent. Avoid all of these goitrogenic agents, and then try to concentrate on eating good food and also exercise properly. If you're pregnant, do Kegel exercises. Do not do any sort of other exercises which will hamper the health of the baby. Okay, and that is why it is very important, if you're trying to getting married also, make sure that your TSH level is proper. And then how is the effect of hypothyroidism on PCOS? We have seen that already. Remember that not only the fertilization factor or the female reproductive system is involved. Remember, PCOS is a syndrome wherein the whole body is involved, majority of the body parts are involved. In the same manner, TSH or this hypothyroidism is also a hormone which almost acts on every cell of the body. Okay, it has effect on every cell of the body. So what happens apart from this, there is insulin resistance happening. It happens in PCOS, it happens in hypothyroidism. If it is happening in hypothyroidism and you don't have PCOS, on a longer run can create a PCOS, and if you're having PCOS on a longer run, it can create hypothyroidism. Both will maintain the insulin resistance, and if both are not taken care of, they can lead into type 2 diabetes. And how is the androgen level increasing in thyroid? We know how it is increasing in PCOS. If you have any sort of doubts on it, we will be providing a link in the description box about the PCOS, how is it formed, or how the syndrome develops, and what are the causes and effects of it, and how should you diagnose PCOS, right? So that will be provided in the description box. Remember that. And then the androgen level in hypothyroidism is increased because the TSH has an effect on the testosterone metabolization, where there is increase in testosterone through an indirect cycle. That is why there is hyperandrogenism present even in hypothyroidism. Apart from that, there is impact on fertility, which we have already spoken, because of anovulatory cycles and very thin endometrial thickness, or abnormal endometrial thickness also sometimes. You have to understand that PCOS and thyroid are interrelated. They are just like siblings, or you can say best friends. If one person is there, the other will sooner or later come. So if PCOS is there, if it is not properly taken care of, can lead into hypothyroidism. Hypothyroidism can lead into PCOS, and both of them can cause ovulatory dysfunction. If you're someone who's suffering from female reproductive organ diseases, we have discussed how homeopathy is a better stand than allopathic form of treatment. And in homeopathy, Fidicus homeopathy gives you a best chance at health. If you're someone who's suffering from all of this, we have two kinds of consultations, which is online and offline consultation. If you're staying nearby the nearest branch of Fidicus, you can contact us in person, or you can come in person and contact us, or take a consultation with us. And if you're someone who's staying far away from us, you can contact us online through audio consultation options or through the video consultation options, right? And after consultation and after the investigations have been verified, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, 3 to 5 business days. And apart from that, across the globe, anywhere, it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us or know more about us, you can contact us on this number, call us, WhatsApp us, or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. We have discussed how homeopathy is a better choice in treating lifestyle disorders, right? And we will now discuss why Fidicus Homeopathy is a better choice, because Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. 1, we have already having good or high success rate in treating PCOS, PCOD, bulky uterus, dysmenorrhea, fibroids, endometriosis, adenomyosis, as well as cervical erosion. So we have high success rate in treating these cases. Apart from that, we have transparent treatment. What do you mean by transparent treatment? There is no gray area between the patient and the doctor. The prognosis will be clearly explained to you, and the personal care here at Fidicus is top notch. We will be answering all of your questions and letting you know if there is something that your case demands. If you want to choose health, if you want to choose cure, choose Fidicus Homeopathy.
Fidicus Homeopathy.